Hi, I'm Dr. Anthony Raimondo. This is what I teach, and today I'll be talking to you about epilepsy and a possible cure. But before I do, I want to give you a brief background of myself. First of all, I am not a medical doctor. I have a PhD in education. I am also a certified hypnotherapist, and I hold a 4th degree black belt in Yoshikai Karate. But the reason I'm doing this discussion or this talk on epilepsy is because at the age of, and this is the first time I'm coming out publicly with this, at the age of 9, I was diagnosed with petit mal epilepsy. My father took me to a number of doctors, and I was prescribed, I was told I had to take, at that time when I was 9, which is a number of years ago, was a phenobarbital. And the doctors also told my father and I the things I could do and the things I couldn't do. A long list of not standing next to open windows, especially if they were second story or above. Not to cross the streets alone, not to ride a bike, not to play ball, not to do this and not to do that. Well, at the age of 9, I told my dad that under no circumstances was I going to follow those rules, nor was I going to take the medicine on a regular basis. I was rebelling from that very point in time. And as a result, I had a number of seizures, maybe 30, 40 a day. And petit mal seizures, basically my eyes would roll back into the back of my head. I would become unconscious for a period of maybe 10 or 12 seconds and then return. But obviously, in a 10 or 12 second period, you could get hurt. And as a result of my disobedience, not that my parents would buy me a bicycle, but I managed to scrap parts together and I put one together. And I pretty much tried to live what I considered a normal life, living like everyone else. My peers, my schoolmates. However, since I was a petit mal epileptic and not taking medication, I had a number of accidents in school where, I would urinate on myself, lose control of and wet my pants. As a result, you could see that, I was pretty much, verbally abused by my classmates at that age, and even older. They would call me names because I had these seizures. But on and on, I continued not to do it. At the age of 12, I managed to have a bike, and I went bike riding one day, and during a seizure, I hit a cast iron fence, and I didn't even know it, but I broke my nose. I actually split this bone in half. It stuck out. I looked like a rhinoceros. And I went home, blood all over me. My brother walked the bike home, and my mother saw me. She passed out, and when she came to and whatever, they took me to the hospital. I spent 5 days in the hospital with a serious nose injury. But that didn't stop me. And my rebellious attitude continued, and when I got to be about 16, I saw a film about Sigmund Freud, and it ended with "Know Thyself." So I began to meditate, and this brings me to my discussion today: meditation and its effects on epilepsy, at least petit mal, and I'm sure this has an effect on other forms of epilepsy as well. And at the age of 16, I began to meditate. And all along, I refused to do what they suggested, what the list, and on and on. And I had also discovered that Julius Caesar, a general, went to battle with epilepsy. Napoleon was an epileptic, and he went into battle with. So these were great men who did not allow epilepsy to interfere with their life, and I had made the decision to do the same. And as a result, I never ever put on an application of any kind that I had seizures. I was determined to live my life that way, and I have. And because of what I'm seeing on YouTube, parents and people looking for a cure for epilepsy, I decided I'd make this video. Now, I had visited brain surgeons. When I was 14, I talked to one of the best brain surgeons at the time. He was living had a practice in Naples, Italy. My father took me to Naples, Italy, and we went to see this brain surgeon who said that basically all I was trying to do was remember something that I couldn't remember, and I would try real hard to remember this thing, and basically I'd blow a fuse. And if you know anything about epilepsy, that's basically what's going on. Epilepsy is a disorder that there's a overactive electrochemical process that takes place in the brain, and just like an electrical circuit with a circuit board in your home, if you overload the circuit, it kicks out. And that's what would happen. I would go into electronic explosion, if you will, and I would short circuit. I would lose consciousness, and then when the electrical storm subsided, I would become conscious again. And that's basically what would happen with me. I'm sure other forms of epilepsy, the same thing occurs, only the reaction is different. I sometimes equate it to looking at a monitor. If your monitor on your computer goes a little haywire, you end up with a bunch of like block colors all over the place, but you can't distinguish what's on the screen. So there's some type of overload, and it short circuits. Well, it's the same thing with the brain. You have an overload and it short circuits. So now another explanation or another metaphor is, if I have a 15 amp circuit and I start applying 20 amps or 25 amps of electricity through that circuit, the circuit board, the switch is going to kick because it's too much electricity going through that circuit. Okay, so rather than burn up, it shuts down. Well, in electricity in the home, if you know that that's a 15 amp circuit, basically all you have to do is never apply more than 15 amps and you're running fine. Well, in my lifetime, as I began to use meditation, my seizures began to diminish to the point where it was safe for me to now apply for a driver's license to drive like everybody else. And as a result of my meditation and learning about myself, I can honestly say that from the ages, in 45 years of driving, I've never had an accident as a result of epilepsy. I've had accidents, but not because of epilepsy. I've had accidents just like they would happen to anybody else. So, because you can't stop someone from hitting you. And I've led a normal life my whole entire life. And I've never used epilepsy as a crutch. I've never applied for a disability. I've never done any of those things. I've never put it on an application. Okay? But now I want to share this information with parents and other people who may be suffering from this and possibly give them some insights. As I said, I'm also a hypnotherapist. Because of my years of meditation, I studied hypnosis, because hypnosis and meditation are pretty much the same thing. Now, what exactly is it, and why is it that meditation can help an individual with epilepsy? What is going on? Well, there is a chemical, and the abbreviation is GABA, GABA, gamma aminobutyric acid. Now, if an individual is deficient in this particular amino acid, your brain, you may have seizures. You may also suffer from anxiety or other disorders. Okay, so it's an important element or amino acid that the brain requires, along with DHEA and a few others. Now you can go to YouTube. You can Google this information. If you Google meditation and its effects on epilepsy, you'll find the information that I'm referring to. Okay? And what they found is that meditation will actually increase, right, gamma aminobutyric acid, GABA. It will enhance that. And as it enhances, you will notice that your seizures will probably diminish, or they'll be shorter in length. You may have fewer of them, but meditation is the key. Now, what type of meditation? Well, when we begin to meditate on peace and love, what happens? We begin to reduce stress, we reduce anxiety, we reduce worry. These are all the things that cause the brain to become hyperactive. We're overloading the circuit. By doing these things, we now have a 20 amp, we're running 20 amps through a wire that only requires 15, and we're going to short out. When we meditate, what happens is we now reduce that activity. See, we go to peace. We reduce that activity, and by reducing that activity, naturally, there's a less likelihood of an electric overcharge. By reducing that activity, we reduce the risk of having a seizure. Also, meditation will increase certain elements, chemicals in the body, such as DHEA, melatonin, serotonin, and as I said, gamma, butyric acid, GABA. Okay, it's a tough word to remember. But at any rate, these are things that will happen under meditation that is at least 15-20 minutes every 15, 20 to 40 minutes a day, every day. It has to be a habit. You have to be doing this on a regular basis. Now, I know it's difficult to have 3 and 4 and 5-year-old children meditate. However, as parents, we can teach our kids how to daydream. And we can teach them to daydream positive, fun, loving experiences. The more we dwell on the negative, the more the child begins to dwell on themselves, developing low self-esteem, on and on and on. You know, if they're already getting called names, called names by peers, we as parents and adults don't need to add that. We need to focus on the positive, on the strengths that the child has. We need to teach the child how to daydream, because daydreaming and meditation are the same thing. We need to teach the child to meditate happy, peaceful experiences. And when we do, we increase that one major component, gamma-aminobutyric acid, GABA. That's number one. We also begin to do other things. Okay, as I said before, less likelihood of having an electronic explosion. We go to peace. We're teaching the mind how to be peaceful and calm and relaxed. Now, don't take the doctor's word for it. If you don't believe me, do the research. It's out there. When I was a kid and I was 9 years old, there was no internet. There was no YouTube. There was only the library. Okay? And a 9-year-old kid doesn't necessarily know how to do research. I'm grateful to God that He gave me a sort of a rebellious nature so that I would not participate in that thinking, and that God led me to meditate. And in that meditation, and through that meditation, and through that prayer, I was able to cure myself of epileptic convulsions. Now, if you will, I've come out of the closet to share with you what you can do with your children and what your children can do for themselves. Okay? There's no reason to think of this in drastic negative measures, because there is a simple solution, and that solution is peace. Peace. Meditating on love, compassion, and peace. Bringing the level of brain activity to a lower level, because individuals with epilepsy, when you look at the history, these are men and women who have an overworking brain. And that's not negative, that's positive. That's an individual who has capacity to do great things. Caesar, Napoleon, just to name two. Now you may not like those guys, but they achieved a level of greatness. They became generals and leaders of their country, regardless of whether they were benevolent or not. That's irrelevant right now in what I'm trying to present to you. And I'm sure if you do the research, you'll find other great human beings. So that it's this active, overzealous brain that wants to work and discover things. So what we need to do is show it how to do it from a lower key. Meditation, going to peace, thinking about compassion and love will actually physically alter the frontal lobe. It will alter the brain. I'm Dr. Anthony Raimondo. This is presented by Accelerating Evolution. This is what I teach. Check out my profile. There's ways to contact me. Send me a comment. My email's listed on the profile. Write to me. If there's anything I can do to help you and your child, or if it's you yourself, contact me, and I'll share whatever information I have. I have this YouTube channel There are meditations already listed. Begin to follow them, begin to learn them, begin to practice them. And I'm sure that you will begin to see a difference in yourself or your child, in that less seizures, shorter duration, or possibly even a cure will occur. God bless. I'm Dr. Anthony Raimondo, and I wish you well.